Whether or not I need accommodations, that's a different story, but I'm really proud to have hearing loss. And that has actually made me a better pharmacist, to be honest with you. I went to this room where everybody sat around the table and we did our introduction, and people, for the first time, people openly shared about their connections with disabilities. And all of these people were nurses and doctors and, social workers. And my mind was just blown. I was like, really? I thought I was the only one. And here I am. That the community makes such a big difference. And I was literally bawling for for in that moment for days. I was like, wow, I feel so empowered that I'm not alone.
Welcome to Life as a Patient Doctor. I'm your host, Stephanie Moss, navigating life as a patient and a future MD. Walk alongside me as I reflect on the challenges and lessons I've learned undergoing medical school with invisible disabilities. Join me as I interview other doctors, students, and healthcare workers on their own journeys. Listen to their unique stories on how they have balanced their health while caring for others in the health profession. Welcome, everyone. Today, I have a very special guest. Kruti Shah, who's a PharmD, is a clinical operations pharmacist at Rush. She serves as a steering committee member of the Disabilities Employee Resource Group, DERG, at Rush, and is a co-chair of the DEI Committee of Illinois Council Health Systems Pharmacists, ICHP. Recognizing the significance of intersectionality in healthcare, Dr. Shah has spearheaded health system-wide initiatives aimed at fostering wellness and inclusion. During the pandemic, when medical masks became a barrier to lip reading, she advocated for clear masks to improve access to communication for employees, patients, and visitors. As a former public health Voice Fellow with the Op-Ed Project, Dr. Shah utilizes her platform to raise awareness and promote disability-affirming care. She has published an article in Newsweek shedding light on the importance of inclusive practices and challenge societal misconceptions surrounding disabilities. Dr. Shah is passionate patient care advocate and educator advancing the rights and access for individuals with disabilities. Through the Disability Lead Fellowship, guest co-hosting the Docs with Disabilities podcast, and being involved with the Disability in Medicine Mutual Mentorship Program, DM3P, she works tirelessly to make pharmacy professionals equitable, diverse, and inclusive. Welcome, Dr. Shah. Thank you for being here.
Thank you so much, Stephanie. Dr. Moss, almost there. For having me and for welcoming me. And thank you for a wonderful introduction. Appreciate it.
Oh, of course. I'm so excited to get to know you more. I was just realizing all the last parts that you're a part of, I'm starting to become like really grouped in with the Docs and Disabilities, the DM3 piece. So it's really cool how just the community is there and we're connecting, but we'll talk about all that stuff here soon. First, I really would just love to hear your story. Tell me about you and your journey into medicine.
Thank you, Stephanie, for creating this platform and for giving me an opportunity to share my story. It really creates that safe and vulnerable as well as brave space for people. So I truly appreciate you having me. So I am a pharmacist by profession, but really my journey with disability begins when I was 3 years old, and my parents all of a sudden noticed that I wasn't responding to certain soft sounds. And I was born in India, actually. When I was in India, my family noticed that I was not responding to some of the soft sounds. So once they took me to an audiologist and an ENT there, what they realized is that I have mild to moderate hearing loss. Now, growing up in India, where disability is associated with a lot of stigma, disability is something that if it is invisible, keep it invisible, don't talk about it. Because if you do, you're automatically going to be somebody who's never going to exceed in education or jobs, or even, a lot of times people think about marriage or relationship. And so knowing what my parents knew and coming from the culture of, cultural background of trying to really show or put the best foot forward, my parents decided to kind of, hide disability. Even the ENT physician, not just my parents, but even the ENT physician recommended to me to just not talk about disability in class, like not talk about hearing loss when you're in school. Don't talk about it with your friends or teachers. Just kind of lip read. Just sit in the front row when you're in a class and just read and focus on lip reading. And so really did not have access to hearing aids all the way until I turned 16, which is when I moved to Canada. And when I first saw my family physician, just doing a full workup, this is in Toronto, my family physician's like, "Oh, you told me about your hearing loss. Well, where are your hearing aids?" And I'm like, "Well, I've never had them." And they're like, "Really? How is that possible? Let me get you to an audiologist." And so she referred me to an audiologist. And for the first time at the age of 16, I wore hearing aids, and it was a game changer. I could hear the keys jingling. I could hear the soft sounds of like the high frequency sound that I was just never exposed to. It just felt amazing. So half the battle was won, but the other half was just embracing my disability. I wasn't super comfortable talking about it even after having hearing aids. And I could share more, but I just wanted to mention that is how it all started. So I still, have mild to moderate hearing loss and I wear hearing aids.
Wow, thank you so much. How inspiring of a story. And I connected with that so much. The having a stigma, not talking about it. And then when you said the first time you put on hearing aids, it's like you could hear for the first time. Everything seemed clearer and better for you. And I remember the very first time I received accommodations for my testing. It was just like, oh my God, I've been going through my entire undergraduate school education, struggling, anxiety, and now it's easier. I feel like I can do this. And so I'm wondering if it's like that's kind of the emotion that I kind of get of like, oh, I'm okay. Like things will get better. But yeah, tell me more. What happened next?
Yeah, thank you so much for sharing that. Yeah, I definitely felt that I did have access to more sounds. Now, what people will say, and this is my personal experience with hearing loss and hearing aids, is that um, it doesn't 100% correct it. It gets you close to 95%, 90 to 95%, depending on hearing loss. Everybody's different. At least in my case, I could say got me to 90 to 95%. Most of the times, if I am in line of sight with the person who's speaking with me, lip reading really helps to even if I misheard some of the sounds. So here's the other part is that I guess I don't want to go into too much of nitty-gritty detail. The fa and the sa sound will sound really similar if somebody's not looking at me. But if I'm looking at them and their lips move, fa and sa will be different because I could see their lip move. So now I'm now imagining the class size, and so high school, with hearing aids was definitely easier because the class size was smaller. But the hardest part was going into college. So I went to University of Toronto for undergrad, and our chemistry class was like 150 to 200 students, right? It's a huge class. It's almost like a theater type of setup. And with the microphone, the clarity of sound is not that great. So I remember going to the accessibility office and asking them to see if I could have an accommodation. But here I am still trying to, I mean, in undergrad, I know there's a professional school line ahead of me. I want to do more with my career at the age of 18, 19. I still don't want to be judged. And because of the mindset that I mentioned to you, growing up in a culture where we don't really talk about disabilities, I didn't feel comfortable yet to just like disclose my disability so openly. So I used an accommodation called a note taker who basically take notes in undergrad. And then I would, look at their notes to make sure that I didn't miss anything. And if I did, that would help supplement my own kind of listening and learning. But then when I went into pharmacy school, which was at University of Buffalo, that's where I didn't reach out to the accessibility office. I didn't know what was there. I didn't know, honestly, as time progresses, technology makes it easier for captions now. But back in the day, I did not know of all of those accommodations in a way that there was no real conversations about it. I also felt as though I'm in this competing environment and I have to show that I am not a burden, that I'm not. Again, I think accommodations are never burden and they're my right, but I didn't think about it at that time. For me, at that time, in the survival mode, instead of thriving, I was just surviving. And so I look back, and obviously there's a lot of it that I wish I did differently with the knowledge that I have now. But it's not only just my fault or lack of understanding or knowledge on my part. I also think in healthcare, we don't normalize accommodation or disability. It's all hush hush, or like we make it almost that it's unsafe to use some of those accommodations. And so I think it was a product of both. And I think it has come to a full circle now that I think about it. Full circle is that University of Buffalo Pharmacy School and I are now in connection with each other. And I'm actually going back and doing a lecture and a panel, Q&A panel with students as well as faculty, talking about, having disability is something to not be ashamed of. In fact, it's applied. It's something to be proud of. And that access accommodations, those are for you to succeed. You don't have to work hard like I had to, double listening the lectures, take advantage of some of the things that university has, and that has nothing to do with the way it shouldn't and it will not affect the way you present yourself. It just helps you succeed rather than survive.
Oh my God, thank you. That was perfect and so relevant to the conversation that we've had in this podcast and through the conversations I've had with other students who feel like they're a burden and feel like they're just trying to survive in the stresses of school, and then add in any other mental, physical, invisible disability or health condition instead of just thriving and enjoying the learning experience. How did you get over that hump of that emotional burden or feeling like you were a burden?
That's a really good question. Stephanie, thank you for asking that question. I will say this thing we do share in common, and that is rush, the way it all happened. And I will tell you, I know you're a Rush University student and I work at Rush University Medical Center, so there's Rush in common. And the way this happened is I had just started working at Rush as a clinical operations pharmacist. Now, as a pharmacist, once I graduated, I worked at outpatient settings. I also worked at different inpatient settings. When I started working at a pharmacist at Rush, there was something called Disabilities Employee Resource Group, and I got an invite. And this person by the name Kevin Irvine, who a lot of people at Rush and outside in the disability community know about, a great mentor, he had reached out, just sent out a listserv, like an email, and I happened to read one of them, and I'm like, let me check this out, what this is about. I know I have a disability. I haven't been super vocal about. And for the first time, I went to this room where everybody sat around the table and we did our introduction, and people, for the first time, people openly shared about their connections with disabilities. And all these people were nurses and doctors and, social workers. And my mind was just blown. I was like, really? I thought I was the only one. And here I am. That the community makes such a big difference. And I was literally bawling for for in that moment for days. I was like, wow, I feel so empowered that I'm not alone. So that was step number one. And then right after that, about 3 months later, so I joined Rush in 2019 November. In 2020 March, we know the pandemic happened. So literally 4 months in, mask became mandatory. The COVID hit, and all of a sudden now, with masks becoming a barrier to lip reading, I struggled. As I was mentioning, that lip reading is so important for me to communicate. And so when I went on rounds, or when I was talking to the patients, or when I was in a meeting, I felt that I was missing out a lot of information. And so those were the difficult days. After, going every other month, we would have the DERG. I voiced my challenges. Turns out there was somebody else who also had hearing loss. And together we thought about, what can we do? And so there were clear masks that were coming out on the market. At this point, we also didn't know how long is the pandemic going on, will go on until. And so I thought, oh, a few more months, I think I can handle this. But then it was just not, we were just not overcoming this. Another layer, and I'm sorry to bring this on, but I was actually pregnant at the time. So I already went through one pregnancy with my first child, who's now 5 years old. But my 3-year-old, who I was pregnant with, every doctor's appointment, even though I went to doctor's office before for pregnancy, I knew exactly what to expect. All these masks, face shield, and then plexiglass made it so much harder for me to communicate with the doctor, with the physician's team, with my OB team, even during labor and delivery. It was like, what did you say? Did you say Pitocin or something else? It just, I'm like, I'm a drug expert. I'm a like I'm a professional. I can have a conversation, but just mask is making it so much harder. So access to communication was definitely taking a toll on me, whether I was a patient or a professional myself. So I could kind of feel both. And for that reason, I felt that having clear math would be game changer. And so after kind of writing letters to leadership, talking to my managers, I was like, we really need clear masks. They were finally available a month after my daughter was born, and I was still on my maternity leave. And I remember being so happy that clear masks were finally official at Rush. And then now we have them in patient care areas. I advocate. I feel like a lot of patients and visitors are also able to access them when they need for communications if they have any hearing disabilities. I guess to answer your question, I realized that actually being hard of hearing, I was able to advocate for clear mask, and it not only helped me, but it helped so many other people. So why not be the voice, even if it's a marginalized voice? It is helping so many people. Similarly for Captions, it's the exact same story. And I felt that it was no longer for me. Captions help so many people. And so now for pharmacy grand rounds, for any virtual meeting, we make sure that the captions are available. So then everybody, not just people with disabilities, could follow along.
Oh my goodness. Thank you so much for saying it. Turned it on for all my Zoom because I was even using it for myself and it was so useful, even though I normally didn't even think I needed it, but it is so useful because it's hard to, especially in the Zoom area, being focusing all the time, it's hard. And so it's so interesting. It made me start thinking of like, you mentioned the community circle you had with Kevin and how that experience of feeling like you weren't the only one. That sentence of feeling like you're not the only one or I'm not alone anymore is exactly the reason why I created this podcast. Because so many times we feel so alone in our own struggle, and then when we're dealing with challenges, it's very lonely. And so being able to hear that there are other people out there that are also struggling, that's how we can connect with others. And from a mental health perspective, that's how we can become empowered. And I'm so glad that you had that experience in your own work environment, which I'm sure is so rare in this time period. I have yet to hear of another group like that besides the one at Rush. We do have some that we're starting to build up with students, but in an employment setting, that is amazing. When you originally applied to Rush, did you disclose your disability or how did that work?
Yeah, that's a really good question. Going back to pharmacy school too, I did not. I didn't, to be honest with you, it was not with any malintention. I think at that time it was more like, yeah, it's there, but I've, managed to work around it. And I wasn't, honestly thinking about the fact that whether I was going to need accommodations or not. Even at workplace, it's possibly because I'm learning what I did in 4 years ago, 5 years ago, may be very different than what I would do now. So I just want to make sure that even disability journey in itself is evolving. It's evolving for the people, the society, but also my own disability journey is evolving. And so I think it's really important to reflect that I'm still the same person. The only thing is I didn't talk about it because I felt that during my interview at Rush, for example, talking about all the accomplishments and what I do, all of that was important, but I didn't think that it would make a huge difference. Honestly, I didn't think that I'm going to ask for something that's not already part of the environment. Like I think in terms of communication, like if there is something that I need, I couldn't hear my colleague, I would just say, hey, can we step aside in a quiet environment just so that I could hear you? But it's not like I'm requesting or I would need a particular accommodation going in. I didn't know what accommodations would be available anyway. So I felt that time my mindset was hey, if I talk about my hearing loss, then somebody may make assumptions that, oh, what if she's not able to talk on the phone properly? What if she misunderstands what a nurse or a physician or a patient is saying? And so I know that I have been, in the past, I have my way of figuring out problem solving. If there is a problem, I'm never going to put my patients in at risk by just assuming that the person who I was talking to said this. I would always clarify. So I also didn't want to create that doubt. And honestly, also, I felt that if I do talk about my hearing loss, then the next question would be, okay, then what do you need in terms of accommodations? But I didn't know if I needed anything until I actually start working in an environment such as Rush, because every workplace is so different. Every workplace has its own kind of noise level or distractions that I would have to work it out based on where I'm working. So that was part of the reason why. But now, if you were to ask me, any future, conversations, any important dialogues, I feel that it's now a huge part of my identity. And so I would never want to hide it. It's just the way who I am. Whether or not I need accommodations, that's a different story. But I'm really proud to have hearing loss. And that has actually made me a better pharmacist, to be honest with you. And now that I just leave it at that, to be honest.
No, please, that actually is really helpful. That leads into the other question of how has it? Well, okay, yes. Let's put a pin in that because I want to ask you how it's helped you be a better provider. But yeah, what would be the advice you would give yourself right now of how to disclose or to another individual with disabilities or with hearing loss?
So I've been really fortunate that after really learning about Clear Mask at Rush and having the DERG, which is the Disability Employee Resource Group through Rush, I actually did a leadership fellowship called Disability Lead. A Disability Lead is a Chicago-based fellowship. It really helps to become a leader in advocating for access, inclusion, and honestly, promoting education related to disability. And one of the things that was really powerful from that was that disclosure that I learned with that disclosure is a personal choice. It is really up to that individual whether they want to disclose or not. If I were to put myself in a situation of having all the knowledge that I do and understanding that ADA is actually a right, I don't have to feel that I am a burden on an institution. If I have a choice of disclosure, I will fully disclose because I also want to be in an environment where I'm going to be working with a team who understands and values disability as diversity. And I would obviously give examples as to why this disability is not something that's holding me back. And if I am giving the opportunity to even take away clarify any misconceptions or ableist beliefs, then why not? Why not from the get-go? I share with them what makes me a full and individual, what makes me who I am. A large part of it is my disability.
You are an inspiration because that's exactly what I want to do. That was my similar type mindset when I went back and forth for months before my residency application of do I disclose? Do I not disclose? Like do I feel like I'm hiding it? But it is a personal decision, but I've been able to get what I need on my own. So all these questions, but then that is kind of a similar thing that I came to is I want to be an environment where, like you said, disability is a diversity where you can combat ableism, combat the ideas maybe individuals with disabilities are not successful or are not medical providers. For my own personal decision, there is more benefit than the potential harm. But that is not for everyone. Like you said, it is very much a personal choice and individual opportunity, but it's so this is why I want to hear the stories of people who do take the leap and to show that it was a positive to do it and to inspire hopefully others to be advocates just like you. You were talking about how your disability has helped you be a better provider. besides the masks, which are awesome, I remember using them in my psychiatry actually clerkship the first time one of the staff members had it. And I remember wearing it. I was like, yes, where have these been for like the past 2 years? I even had like an older individual that had difficulty hearing, and they were also so happy that they could finally see the facial expression. So, you know, positive for our patients, positive for own staff. So many positive things for from those masks. So thank you so much for bringing those in. But yeah, tell us more about how disability has impacted your work and made you the person you are today and a better pharmacist.
And that's a really important question because every day when I set mindset for the day, I want to make sure that I'm leading with love, leading with my disability identity. And to be honest with you, when I made myself vulnerable, first of all, the impact it had on the colleagues that I was working with, people felt safe in being themselves. People opened up about their invisible conditions. It could be anxiety, it could be a family member's depression, PTSD, neurodiversity, and it made our workplace in itself a healthier, a more open workplace. So, already I could see that shifting with me sharing about my disability. So, in terms of what I do as a hospital pharmacist, I also have clinical roles where I see psychiatry patients, actually inpatients, so patients who are admitted in the hospital for psychiatry conditions. And my interaction with patients would be when I am doing a medication reconciliation or medications counseling at discharge. The patient is about to go home and going over their schedule of medications. Yet sometimes it's overwhelming, especially being in a hospital setting. So many different providers that are coming to see you. And it's overwhelming because now you're worried about transition of care. How am I going to transition to stay well, to stay healthy, to stay mentally spirited in all, once I leave the hospital? And when they were in vulnerable moments, I remember telling them, or even, on my discharge counseling, I say I'm, hard of hearing. And just by saying that, and I say that I use lip reading. So just making sure that they kind of, I'm talking to them and I'm able to read their lips. I think that in itself has made my patients really comfortable to feel that, okay, they can be vulnerable as well to me, that they can share their challenges about not being able to remember their medications at time, or that they, are really worried about what this means. I've had patients, for example, when I'm doing counseling on marijuana or, substance use and how it impacts our day-to-day lifestyle. I feel like just going in and sharing my vulnerability makes them feel that they're able to relate to me. And this whole, invisible disability under the umbrella of disabilities, there's this sense of community. And when patients feel that I'm one of their own, I think that's what makes a huge difference.
Yes, I totally resonate with that. And I'm so glad that you talked about the disclosure to patients because that is another topic of conversation that I don't think I've addressed yet. That a lot of people ask me is like, okay, we disclose to our work environment, but we're in the health profession. Do we disclose to patients? How do we disclose to patients? You provided how, like, examples that you say. Do you have any further advice for other individuals who want kind of a quick or any tidbits that you have on disclosure?
I think I feel like disclosure, if you think it's important for the sake of, I think to give a full picture in my case, and every disability is different, every individual is different. So, obviously my advice, please take it with a grain of salt. But I think what has helped me is that it eases up when I am tense and I'm taking notes or like trying to understand what the patient is saying. If I'm tensed up thinking, oh, gee, with this person doesn't know that I'm hard of hearing, it makes me a little nervous. So full disclosure, I'm also doing this as a way of getting all the information I need to give to the patient so then they can also be more mindful of the communication style that they're using. I think when it's necessary, I think it would be important for the patient to get a full picture. But it again depends on the situation. I also feel that some interactions are short, some interactions are longer, some are inpatient, some are, outpatient. So it all kind of depends. Some are repetitive, like you're seeing the same patients over and over. Sometimes you're just going to see a patient for a few minutes and then don't know whether you're going to see them as well. Keeping all of that in mind, I think if you feel that the patient will be able to, if you're going to be able to get a good buy-in, or even just, you want the patient to know that you're on the same page as them, I think that in itself is really powerful.
Amazing. Thank you so much. That was actually really helpful and a really good perspective. As we wrap up on our time, are there any last thoughts of advice for future or current health professionals, or any additional tidbits that we haven't mentioned yet that you want to include?
I will say that a disability is something that is not other. The advice that am living with right now, and I can tell, and as I mentioned in the previous conversation, the advice that I'm giving to my younger self is be proud of the disability, of the conditions, of the experiences that you have, because a lot of times we don't realize it, but disability is what makes us who we are, and it makes us stronger. It makes us, gosh, I'm getting teary, even thinking about this, but it is something to be celebrated. It is truly disability something, and I know I can't believe I am saying this because, as I mentioned, I used to think that, oh, this is a weakness that I have to hide, but it is something to be celebrated. So I only realized it once I surrounded myself with community, and sometimes, as you mentioned, you feel lonely. So in order to continuously feel that this is something to be celebrated, it is important to have mentorship, to have community where you see other individuals who have a disability, whether they're healthcare providers in a similar passion line of work that you're doing or outside, but creating that community and celebrating your disability is really, really important.
Beautiful final words. I love it. It's like you said, it is something to celebrate. Everyone is different. Everyone has something that makes them unique and has their own story. And it is something that we should be proud of. Thank you. Thank you for giving everyone that hope and that encouragement. I want to thank everyone for tuning in, and like Dr. Shah mentioned, if you are struggling, you are not alone, and you're not the only one that's been through challenges. There's a community out there of people, of mentorship, of friends that are just waiting to celebrate with you for who you are. I'm going to go through some of the tidbits that Dr. Shah talked about. I want to thank her for sharing her journey all the way from India, talking about her initial emotional struggles and social stigma that prevented her from getting the resources she needed, but allowed her to persevere and develop that resilience that brought her then to Canada, where she was able to receive hearing aids and receive the health care that she deserved, and got to go into the education field and to the medical field even with her disability. And it was so interesting to hear that she went to pharmacy school. She didn't have the information about accessibilities, but she still was successful, and she slowly over time learned to trust herself and to figure out how she could be successful. And then that brought her to her current work at Rush as an inpatient hospitalist and pharmacist. And that's where she really, in the past couple of years, was able to meet other individuals who had disabilities in the health profession field. She found the community and realized that she's not alone. And that kind of spearheaded her advocacy and empowerment journey. And so, Dr. Shah, thank you so much for joining. If individuals wanted to contact you or get more information, how can they do that?
Yeah, absolutely. Please reach out. I'm on LinkedIn, and I'm happy to provide you with LinkedIn. I'm on Twitter, but not super active, and then on Instagram as well. It's something that I could also provide you. I just wanted to say great job with the summary, because within just 45-minute conversation, it's hard to know everything about a person, but the way you've encapsulated everything And as I mentioned, I evolve and my disability journey is evolving. Everything could change for the better. We just be open to change is what I would say.
Thank you. I like that. As I'm writing this, I'm always thinking, okay, what would be a good title? And there's so many statements that you said, but like disability journey evolution or evolution of disability journey. Something like that's kind of what you talked about of the ups and downs and real life. Because
Yeah.
stories aren't linear. That's what makes them so amazing is hearing. And that's why I'm so thankful for this opportunity to listen to the journey of other students, health providers, and I hope that the audience also appreciates the journey.
Thank you, future Dr. Moss, for having me. This was a pleasure, and thank you for opening space for others and for stories. This is really, really important, uplifting, and please reach out if any of the listeners have any questions or concerns. Thank you.
If you are a listener and would like to suggest anyone, or if you had disabilities yourself and in the health profession, I would love to interview and share your story. So please message me. Or if you have any thoughts or comments and suggestions, since this is a relatively new podcast, I would love to hear them so we can get the voices out there to help people feel less alone. Thank you, everyone, for walking alongside me through my journey in life as a patient and future doctor, and then also Dr. Shah's journey. You can find more information and resources that I've acquired and continue to acquire, including resource groups to find your own community at medschoolmoss.com, and you can follow me on social media at medschoolmoss. Thank you again, Dr. Shah, for coming on. Thank you, everyone. See you next time.
See you next time.